Now we're going to move on to On Point, where we speak to experts to delve deeper into the biggest news stories in the spotlight right now. The World Health Organization this week issued a grim warning that the sheer volume of new COVID-19 infections in the coming weeks, particularly of the Omicron variant, could threaten health services not only in Europe but also in other hotspots like North America. The agency's Europe Regional Director listed 3 countries in particular, Portugal, Denmark and the UK, as some European countries where Omicron is becoming or is already the dominant strain. He added that in those countries, cases are doubling every 1.5 to 3 days. And he says that is generating previously unseen transmission rates.
The official went on to say the massive amounts of new infections could lead to more hospitalizations and disruptions of other critical health services, affecting people needing care for other serious diseases. For more on where we stand globally in regards to the Omicron strain, we're joined by Ben Cowling, Chair Professor of Epidemiology at the University of Hong Kong. Good morning, Professor.
Good morning.
Professor, let's start with the data. There's still hope Omicron will be milder than Delta or other strains that have gone before it. So does the data, as you see it right now, suggest that may well be the case?
Well, certainly Omicron infections in South Africa are milder than their previous Delta infections or other infections, but it's not clear whether that's because of an intrinsic difference in the virus, that it's just less severe in general, or particularly because, as your correspondent mentioned, there's more population immunity in South Africa. So that remains to be seen. But I think we're now coming towards an understanding that Omicron is somewhat less serious on average, but the vastly greater number of cases is still going to mean that Omicron poses a major threat. So even if it's a little bit milder, the sheer number of cases mean there's still going to be a lot of serious cases, unfortunately.
Now, the man who invented the mRNA vaccine, which Pfizer and Moderna use to protect against COVID-19, a man by the name of Dr. Robert Malone, tweeted Wednesday, I don't know whether you saw it, but he said that since Omicron has an R0 of between 7 and 10, meaning one person can infect between 7 and 10 people, it's likely to blow in, quote, like a hurricane. However, he added that if you're young and healthy, you should be fine, but older people should be prepared. Do you share his view that Omicron is going to be omnipresent before we know it? And how should old and or sick people prepare, as he puts it?
Well, I think if you look at the case curves in the United Kingdom, it's almost a vertical line. In the US, I think in New York, I just saw the curve as well. It's like a vertical line. Once Omicron starts going, it can take off very fast. And I know that there are cases now in South Korea, so you may see the same pattern within the next couple of weeks. But what we haven't yet seen in the UK and New York and elsewhere is a corresponding rise in the hospitalization counts. And so far, that's good news. But as I said earlier, we're still expecting that there are going to be corresponding rises in severe cases fairly soon. So in South Korea, that does mean I think you have to be on high alert now for larger and larger numbers of cases over the holiday period, and then an increase in hospitalizations threatening your hospital system. And I know your intensive care units are already very full. And one thing I would add, Omicron is not only a threat to the hospital system because of the severe cases, it's also a threat because whenever a doctor or a nurse tests positive, they then may have to isolate themselves, and then the doctor's down on the staff, and that's going to pose a major problem as well around the world.
But Professor, on a brighter note, we just reported that a few hours ago, the FDA gave the green light to Pfizer's oral COVID-19 treatment. The FDA says it will be a useful tool to fight the virus, especially since the emergence of the Omicron variant. How big of a positive is this approval in the fight against the pandemic?
I think it's good news. 2 years ago, when the pandemic started, we knew that we needed vaccines and antiviral drugs, ideally, to help us bring an end to the pandemic. We've had vaccines for almost a year now. And today, as you said, the antiviral drug from Pfizer was approved. I don't know how much supply there is and how soon it will be available outside the United States, but I think it does have the potential to prevent a lot of severe cases if it can be given in the right way to the right kind of people and if there are enough supplies. So I do think it's exciting news.
Yeah, and finally, Professor, many developed countries, as I'm sure you're aware, are in the early stages of giving older people booster shots. However, given the fact that it does take several days, if not a few weeks, for this booster to kick in, to become effective, wouldn't that suggest it's already too late for boosters to be effective against this tidal wave, like you said, vertical line of Omicron that's forecast to hit us here in South Korea imminently, you would imagine?
Yeah, I mean, that means there's a lot of urgency now to get as many booster doses done as possible, because once you start seeing that vertical line, as you said, there's not going to be a lot more time to give out a lot more booster doses before they would really be needed. So I think now time is of the essence, and try to do as much boosting as possible. And I know the travel restrictions are going to help a little bit just to slow down the importations of Omicron and slow down the start of that vertical curve. And then once you do see the vertical curve, some public health measures, I'm sure, will be brought back in, and that will help to slow it down as well a little bit. But right now, if it's possible to do more third doses, I would strongly encourage more people to get their third dose, especially older people and people with underlying medical conditions.
All right. Professor Cowling, thank you as always for shedding some light on these big questions. We appreciate you joining us, and hopefully we'll speak to you again soon.